The commonest cause of chronic pancreatitis worldwide is alcohol. Alcohol consumption, especially prolonged alcohol consumption, more than 5 years, 3 times a week of especially hard liquor, leads to chronic pancreatitis. And people who consume alcohol and have chronic pancreatitis should abstain from consuming alcohol. Another common cause of chronic pancreatitis, which we see in South Asian countries, especially the southern part of India, is called tropical chronic pancreatitis. Tropical chronic pancreatitis, we don't know the exact cause as yet. It is probably related to some exposure to environmental toxins and malnutrition in childhood. Tropical chronic pancreatitis is a very unique entity in that the patients get affected at a very young age. By the time they're 18 to 23 itself, they get affected. It occurs more in women than men, and by the time they're 27, 28 itself, they develop all the complications of severe chronic pancreatitis like severe pain, diabetes, fatty food malabsorption, so on and so forth. The third common cause of chronic pancreatitis is as a sequelae of acute pancreatitis. So normally you have an acute pancreatitis, which is a totally different entity, which is caused again by alcohol, which is caused by gallstones, which can be caused by viral infections, some particular drugs, and some problems in the pancreas like pancreas divisum. So when you have a severe attack of acute pancreatitis in which the pancreas becomes necrosed, the pancreas becomes so badly diseased that when it heals, there is severe scarring of the pancreas and the ducts in the pancreas get narrowed. So this acute pancreatitis, severe acute pancreatitis, because of the scarring it causes, can lead in the future to chronic pancreatitis. Another form of chronic pancreatitis is hereditary chronic pancreatitis, in which the father can pass it on to the kids, and there is a familial transmission of chronic pancreatitis. These patients are known to have a higher incidence of pancreatic cancer as well. A lot of research has been done into the other causes of chronic pancreatitis, because patients do have chronic pancreatitis in the absence of all these above discussed causes. So several genetic mutations like CFTR, SPINK1, PRSS, these kind of mutations have been found to be higher in patients with chronic pancreatitis and could be the cause for chronic pancreatitis. The chronic pancreatitis patients usually present with pain in the upper abdomen, which radiates to the back. It's pretty severe pain, most of the time needing hospital admission or needing painkillers. These attacks can be a continuous sort of pain which goes on for months and years, or intermittent attacks which occur once in 3 months, once in 6 months. Other than this, chronic pancreatitis patients can present with jaundice, they can present with indigestion, they can, because of the fat malabsorption that occurs in the pancreas, they can have bulky smelly stools, something which we call as steatorrhea, oily, greasy, bulky and smelly stools. Then these patients also are at risk of developing diabetes at a relatively young age, because of the insulin producing cells in the pancreas called beta cells are destroyed by the recurrent attacks of chronic pancreatitis. These patients develop diabetes. Chronic pancreatitis causes a lot of health morbidity. One is because the recurrent attacks of pain, the patients develop cetophobia, their fear of food, because of which they are unable to take any nutrition, and over a period of time they have severe weight loss. Patients develop because of the recurrent attacks of severe pain, they develop painkiller addictions, they develop alcohol dependency, they go into depression, there is a loss of work because they are not able to sustain their education or job. Those kind of complications occur. In addition, because the steatorrhea, basically the pancreas produces lipase enzyme, which is the most important enzyme for fat digestion. Because of the fat digestion is affected in patients with chronic pancreatitis, they have steatorrhea, which in the long run leads to multiple vitamin deficiencies, especially the vitamin D deficiency causes bones weakness, leading to pathological fractures in the future age. Likewise, you can get vitamin A deficiency leading to eyesight problems, skin problems. These patients, because chronic pancreatitis affects patients at a very young age, they have, by the time they're 40, 45, they get they've already had diabetes for 20 years. So because of the long-standing diabetes caused by chronic pancreatitis, they have all sorts of diabetes-related problems like diabetic nephropathy affecting the kidneys, diabetic retinopathy, and the diabetic vasculopathy, leading to a higher risk of stroke and heart attack. Likewise, recurrent attacks of chronic pancreatitis may lead to pancreatic cancer as well. Also, because of the recurrent attacks of pancreatitis and inflammation in the pancreas, it can obstruct the nearby intestine and cause vomiting and intestinal obstruction. Likewise, the pancreatic inflammation and the swelling in the pancreas can obstruct the bile duct and cause jaundice and damage the liver. So, the routine investigations like a upper GI endoscopy and an ultrasound may not diagnose chronic pancreatitis. So this is the problem in which patients with upper abdominal pain, they keep on getting evaluated by the same tests, repeated ultrasounds and endoscopies, and the pancreas, because it lies behind the intestine, it lies outside the intestinal tract, the pancreatic disease may be missed. So in these patients with suspected pancreatitis, specialized investigations like CT scan, MRCP, endoscopic ultrasound, and rarely ERCP may be needed to diagnose their problems and plan the treatment. So patients with chronic pancreatitis, yes, there is definitely a role for medication. Pancreatic enzyme supplements need to be given to these patients. Pancreatic enzyme supplements give rest to the pancreas. They help in digestion of the fatty foods and reduce the steatorrhea, which is the cause for many other problems in these patients. So pancreatic enzyme supplementations have to be taken in all patients with chronic pancreatitis. Of course, there are a lot of formulations available in the market of pancreatic enzyme supplementation, but we should be very careful as to what medication we take. The lipase activity is the most important. Many of the cheaper and the local formulations do not have adequate lipase activity. The lipase activity of minimum 10,000 units per meal or minimum from 10,000 to 40,000 units per meal needs to be taken for these patients. This may help in the pain and in the digestion. Likewise, high dose of antioxidants like selenium, vitamin E are available in tablets like Antoxid and Selvit CP, and several formulations are there for these pancreatic patients containing high dose of antioxidants. These have a role in preventing recurrent attacks of pain. Likewise, all these patients, like we already discussed, they have calcium absorption problems and bones become weak. So all patients with chronic pancreatitis should take lifelong calcium supplementation. In patients with severe pain, we can try pain modulators like pregabalin and gabapentin, which have been shown in scientific data to have some role to reduce the pain in patients with chronic pancreatitis. So most patients, when they come with pancreatitis, we try to remove the inciting cause. Like patients who come with alcohol, we try to ask them to stop alcohol, and we put them on a high dose of pancreatic enzyme supplements and antioxidants and neuromodulators like pregabalin and calcium supplements, and we see if the pain is getting controlled by medication. If your pain is not getting controlled by medication, you may need to go for endotherapy and surgery for chronic pancreatitis. So endotherapy is usually done for patients with fairly simple disease like a single stricture in the pancreas, a single stricture meaning a single block in the pancreatic pipe or a single large stone in the pancreatic pipe. These kind of patients would benefit with endoscopic therapy. And patients in whom patients who have multiple stones and multiple strictures in the pancreas, or sometimes the pancreatic inflammation leads to a formation of a mass in the pancreas, or when the pancreas is causing an obstruction in the bile duct or the intestinal pathway, or there is a secondary cancer occurring in the setting of chronic pancreatitis, these patients would benefit with surgery. Surgery has a major role in treatment of patients with chronic pancreatitis. Surgery is done for patients with a dilated duct, pancreatic duct with severe pain and the complications which I mentioned before, like intestinal obstruction, jaundice, and cancer or an inflammatory mass of the pancreas. Various surgeries are done for chronic pancreatitis. The commonest surgery we do is a phrased longitudinal pancreaticojejunostomy, in which the pancreatic duct is laid open, all the blocks are cleared, all the stones are cleared, and we join an intestine to provide good drainage to the pancreas. Then we do other surgeries like a Whipple's pancreaticoduodenectomy, in which the head of the pancreas is resected, a distal pancreatectomy, in which the body and the tail of the pancreas are removed, and head coring procedures for chronic pancreatitis. The success rate of surgery for chronic pancreatitis is about 90 to 95%. If a patient is well selected and a proper surgery is done by a person with expertise in chronic pancreatitis, surgery is a fairly successful remedy for chronic pancreatitis pain. However, not every patient is a candidate for surgery for chronic pancreatitis. Patients with undilated ducts, in which patients with chronic pancreatitis in which you don't have much of large stones or your pancreatic duct size is normal, may not benefit very well from surgery, and the surgery success rate would only be less than 50% in these patients. So if you have chronic pancreatitis and you are suffering from a lot of pain, you would need to actually get yourself checked by an expert and make sure that the surgery is definitely going to benefit you before going in for surgery. The only etiology of chronic pancreatitis in which is preventable is alcohol-related chronic pancreatitis. In these patients, obviously completely stopping alcohol reduces the progression of alcoholic chronic pancreatitis. Other patients, we can't really prevent chronic pancreatitis, but we can prevent the complications of chronic pancreatitis. So patients with pancreatic exocrine insufficiency, that is, like I said, steatorrhea, fatty stools because of the lipase deficiency, they should take the adequate dose of pancreatic enzyme supplements regularly. They should take it at the right time. The pancreatic enzyme supplements are supposed to be taken during the meal, not before or not after a meal. They need to cut down on the fatty food consumption. They need to cut down on the oily food consumption. They need to they need to take calcium supplements lifelong to strengthen the bones. Also, like I said, patients with chronic pancreatitis can have complications like jaundice and pancreatic cancer. So all patients with chronic pancreatitis should undergo regular screening for pancreatic cancer. They need to get an ultrasound and a CA-99, which is a simple blood test to detect chronic pancreatitis. These tests should be done every 6 monthly. Likewise, patients with dilated pancreatic duct and stones and recurrent attacks of pain, it is better not to delay surgery in these patients. If you're having a dilated duct and recurrent stones, if recurrent attacks and further fibrosis will lead to diabetes and exocrine insufficiency. If you have significant pain and you come to a doctor and you do a surgery before these complications can set in, there is some data in literature that shows that the complications of chronic pancreatitis such as diabetes and exocrine insufficiency can be prevented.